tell Golesworthy, who partially pioneered, who was the impetus for the PEARS procedure, has offered a quick PEARS update.
As some of you will know, I went actually to Anne's genetic clinic in 1992 at George's to find, to my horror, I had a dilated aorta. So I had about 8 years of transthoracic echo thereafter, and I was only offered total root replacement, which I didn't fancy very much. So as an R&D engineer, I set about a better solution. So I built a project team, including Tom Treasure, who was cardiothoracic surgeon at George's, John Pepper, got into bed with Imperial College, started the company, raised the money, ran the project, invented it all, and had the first one slapped in me 17.5 years ago. And here I am, and it all still works nicely. So as of the 6th of October, and I've got the project update in front of me, which I produce as and when things happen, we've now treated 539 patients with PEARS, 368 men, 171 females. We've now got a total collective 1,533 post-op patient years between us. We've got 29 patients with more than 10 years follow-up, 78 patients with more than 5 years follow-up. Our youngest patient was 3 with an adult-sized aorta. Our oldest patient was 76. Marfan syndrome, which is where we started, of course, because I'm a Marfan syndrome patient. Of the 539 patients treated, 256 are Marfan. So we're still pretty much half of the total population. But we've done over 30 Loeys-Dietz patients now. We've done about 80 idiopathic aortic dilation. So we're applying this to different treatments. About 70 bicuspid aortic valve disease patients. These are all patients with aortic problems. We've had no dilations, no dissections in those 1,530 years for patients who've had the device correctly fitted. We've got about 31 centers in about 10 countries, but we're still doing a significant number of patients from countries where we've not yet got a PEARS center. So, for example, we did our first Portuguese patient a few weeks ago that Anne will know about. We've done patients from Canada, the USA, Brazil, Colombia, Germany, France, Italy, all of whom have come to existing centers either in the UK, Czech Republic, Belgium, Holland, or Ireland, or for that matter, Australia and New Zealand. The numbers now are picking up nicely quickly. We're down at a very, very low perioperative mortality. I mean, in our aortic cases, we've had 1 perioperative mortality in nearly 500 cases. So we're down at about a 0.2% periop mortality. And as I say, no dissections, no dilations for those who've had the device correctly placed. It is still very, very challenging surgery. It's only ever going to be a minority of cardiothoracic surgeons who will have the skills base to be able to manage this, but it is opening up. It took us 13 years to do our first 100 patients. This year, we will do 200 patients. We're looking in the next 18 months to get FDA approval to offer this to an increasing number of US patients who want access to PEARS. So I would say to any of you who are facing aortic dilation and concerned with it, when you go to see a clinician, you must certainly ask about total root replacement. You must certainly ask about valve-sparing root replacement, but you must certainly ask about PEARS. And do bear in mind that the current guidelines for surgery are written around aortic replacement, not around PEARS. And PEARS is much better applied to small aortas that are the right size, the right shape, and everything works nicely. That said, we have treated a bicuspid aortic valve patient with an aorta of over 6 centimeters, and he's perfectly fine. But my view as an engineer is let's get it when it's slightly above normal adult maximum. It's still dilating slowly. The valve is working, no dissections. Let's fix it then. Thank you very much.
I'm especially impressed with the number of women with Marfan and dilated roots who plan to become pregnant and are having the RAP to prevent dissection during. And one woman, I think, has had 2 children.
Yeah.
Can you bring me up to date on that?
Yeah. Well, of course, I'm not kept up with all the data, but I'm certainly aware that there are at least 11 ladies who've had at least 12 successful pregnancies.
Yes.
And in fact, a recent one in Australia, a lady became pregnant. We made the implant. She had her PEARS surgery in her second trimester off pump. And it must have been incredibly stressful for the surgeon, but the mother and the child are fine.
Excellent.
So the fact that you can have PEARS without having cardiopulmonary bypass makes a big difference. There are at least 2 patients who had had an organ transplant and for whom CPB would have been very dangerous because of the priming fluid, and they had off-pump PEARS operations with absolutely no problem. That's something you can't do with root replacement. You have to be on pump for root replacement. So I think that's probably important, certainly in terms of women who would like to become pregnant, but also in terms of people who have had some other organ transplanted and are therefore at significant risk if they have cardiopulmonary bypass.
Well, thank you so much for that.